Welcome to ODI Bites, a series of events that will address critical global challenges with key experts. We discuss government responses to the coronavirus pandemic and the impacts on inequality. We hear from Jeffrey Sachs, Professor and Director of the Center for Sustainable Development at Columbia University, and Moizza Binat Sarwar, Senior Research Officer at ODI. What is the likely impact of COVID-19 on inequality within different countries?
COVID-19 is accelerating what was already dramatic, a rising inequality within countries around the world. But COVID-19 is hitting different parts of the population within countries in very, very different ways. In general, more skilled workers, people who can work from home, people with more wealth can protect themselves better, of course, from a health point of view. And also can continue their work and incomes, whereas poor people, workers on the front lines, are not only suffering more from illness and death, but are also losing jobs in vast numbers, losing incomes, and therefore suffering that deprivation as well. What's also happening extraordinarily is as we shift from brick and mortar to online economic activities, the wealth of the tech sector has soared. So the world's richest people are really raking it in, which is absolutely extraordinary. We're seeing the largest shift in wealth distribution, I think, probably in a short period of time that we've ever seen, in fact.
What do we know about how government responses are dealing with this inequality?
We're all in this together has been a very popular rallying cry used by politicians across the world. And you can see evidence of this in press releases and conferences held by executive offices all over. And while the pressures may have been the same on the health sectors and in terms of the impact of the lockdowns on economic life, still this idea that somehow COVID-19 is a great leveler is far from true, because individual people and individual countries' resilience to the impact of the virus on both health and income has been far from equal. As Jeff said, within countries, the consequences of lockdown have been unequal for workers in different sectors. Those in highly paid and what have traditionally been considered to be high-skilled jobs have been able to shift to teleworking, while those in the service industry, often on hourly wages or zero-hour contracts, have not been able to make that switch. There's also inequality between sectors and countries where governments have made relief available for businesses. So those in formal work are eligible for assistance through their employers, which is not possible for workers who work for companies that are not on the register at all. So if informal workers do not have income replacement for this lost income throughout the ongoing crisis, I think we're very likely to see an increase in relative poverty across countries. And ILO estimates have put this up to at least 56% of the population for lower income countries. Put up the increase for 56% for lower income countries. Another example of this inequality has been in education. Over 1 billion children are out of school because of the lockdown around the world. And most governments have responded by initiating some form of distance learning. But the methods, TV, internet, and even WhatsApp, rely on infrastructure that is not readily available. And this has had the impact of increasing inequality in access within the same country. So a poll by Datafolha in Brazil showed that 74% of the pupils in Brazil are engaged in some kind of distance learning overall. But in one of the poorest regions in the Amazon in the north, this figure drops to just 52%. So it's not surprising that we're hearing about predictions that at least 10 million children may never return to formal education.
What can global and national leaders do to counter the risk of unequal access to protection from the fallout of COVID-19?
I think the most important thing that we all need to do is to take efforts to stop the pandemic itself. And I mention this because it's often forgotten in these discussions. Even in the United States, as the US Congress works on spending money, some of it valuable, some of it not so well targeted, to overcome the crisis, they're not directing efforts towards fighting the virus itself. And I want to emphasize this point because it's essential. This virus, this epidemic, country by country, can be suppressed. Many countries have done it, especially in the Asia Pacific region. China, Taiwan, Japan, Korea, Vietnam, Lao PDR, Cambodia, New Zealand, and others have stopped effectively the transmission of the virus. Not every single case, but have been able to keep it at very low levels. This enables the economy to continue to function. So while the question is what should be done to protect the poor and the vulnerable, which absolutely needs to be done, the only real way to address this economically is through good public health. We can make compensatory transfers, which we should. We should help the unemployed. We should help people who have lost their incomes. We should ensure access to food. We should be monitoring hunger hotspots. All of that, certainly. But we have not directed the global or the national attention in most places in the world to the most basic point, which is stop the transmission of the virus so that a substantial part of daily life and economic life can go back to normal. That is good public health. And today, good public health is the surest way to help the most vulnerable and to help all of societies to get back on track of some kind of decency and normalcy. In the interim, help the vulnerable through all kinds of programs and transfer payments, but direct the attention to stopping the pandemic. Mr. Trump, Mr. Bolsonaro, and other irresponsible leaders, get on the job.
I think I'm going to take a little bit of a longer run view, but hopefully arrive at the same outcomes that Jeffrey has spoken about. I think in the long run, taking steps to build a different kind of social contract should be a priority. And although that we know that a social contract, which is the agreement between governments and citizens on the moral and political rules on how their society is run, although we know this can be specific to a country because of its particular history, we also know that the COVID-19 response from governments did tend to deprioritize similar people and sectors across high, middle, and low-income countries. It was vulnerable communities, and it was sectors such as health, education, and social protection. So what would a good social contract have looked like in this crisis? In what is it that ideally we would like governments to be aiming for? And I think it would have been people, regardless of socioeconomic status or religious or ethnic or gender identity, trusting what the government is saying in a crisis, following those guidelines, and taking adequate measures to contain the crisis, because neither their daily, nor their monthly income, nor their life savings were at risk by following these guidelines, and because staying in lockdown was something they and their families could do safely. Because we know that crises born of natural and climatic shocks are likely to become more frequent, governments will need to build a kind of contract that is resilient to such crises. And national leaders can do this by beginning investment in universal social protection systems in the long run, rather than opting for short-term efficiency or temporary measures. A social protection system should not be seen as a cost, but as an asset. It will mean that responses to the crisis are integrated within the national social protection system, rather than seen as a separate or parallel activity that needs to begin from scratch every time a shock occurs.
Which countries have responded to the pandemic in a better or worse way than you might have expected?
One of the striking international and within country dimensions of COVID is that the more unequal are the societies going into the pandemic, generally the worse has been the outcome. So the United States is the most unequal of the rich countries. Brazil is one of the most unequal countries in the world. South Africa, one of the most unequal countries in the world. They're unequal because of their histories and their politics. But inequality carries a very, very heavy price. Societies don't get organized in a unified way. The vulnerable are left to suffer, even to die, or they're neglected, and so they end up highly vulnerable. So it's rather a striking phenomenon that bids us to pay attention that we should have been paying beforehand much more urgently to SDG 10, which is to reduce inequalities within and among countries. There are so many reasons for that, of basic social justice, meeting the needs of all people, leaving no one behind. but we see it in the international epidemic response as well, statistically and clearly on the map. More equal societies tend strongly to be more effective in responding in a unified and in a trusting way, which is vital to achieve the suppression of the virus and a quicker recovery.
One of the most interesting things to come out from the crisis has been the similarity in the international response, which has primarily been in leaning towards the use of social assistance and most specifically cash transfer programs. So we saw a high number of countries, regardless of their income standing often, with or without donor support, using cash transfers to support people's livelihoods during the lockdown. One of the examples of this was Pakistan's cash transfer program called BISP or EHSAS, which was an exercise in relatively quick and fairly safe socially distanced response. The program aimed to reach 12 million people initially, but has increased this number recently up to 16.9 million families. And one of the reasons they were able to do this was because the infrastructure for the system already existed, and it was expanded to meet the crisis. Another response to MARC has been Ghana, where the focus has been on prevention. The government had an incredibly swift response to the onset of the virus. They initiated contact tracing, aggressive testing, as well as a huge public announcement campaign. About 100 TB labs were repurposed to ensure that each region of Ghana had at least one COVID-19 testing center. And I think this heightened institutional response was perhaps likely because of the government's preparedness in the face of the 2014 Ebola outbreak 6 years ago. And in 2020, this has translated into the Ghanaian government demonstrating very rapid coordination across different government agencies. So these are hopeful examples, but the proof is always in the implementation. So we will have to wait and assess the overall impact on the most vulnerable populations in these countries in the next few months.
I'm also very happy to add to what Moizza has said. I've been working with the government of Ghana for now 15 years on the community health worker programs. In other words, to have frontline health workers in communities, to help communities have links and access to health facilities. This community health worker program is playing an extremely important role in containing the pandemic. And this is a feature that should be brought to scale across all countries. In fact, high-income countries also need community health workers helping communities to protect themselves and to be able to respond to health crises such as COVID-19. But thank you for mentioning Ghana. It is really an exemplary case, and it's a very important case also where through several alternations of power from one party to the other party, there has been a consistency in protecting and promoting the public health system.
Please share with us your final thoughts.
The basic message is stop the pandemic. We can't wait for the magic bullet of a vaccine, though we hope for one. This virus can be stopped, but in order to stop it, all communities, the poor as well as the rich, need to be engaged and need to be empowered. Public health is economics now. Public health is the way not only to survival, but to the kind of economic recovery that we so much yearn for.
In this crisis, there are a lot of policy taboos that have already been broken by governments in how generously some governments have responded to the crisis in all countries. And I think it would be a waste of an opportunity if national leaders don't use this juncture to work with social protection policies they have on unemployment, on public sector health, for example, and make them as universal as possible. So it benefits those traditionally ignored by social policy and reaches out to them without targeting them in a way that's stigmatizing. It'll definitely help deal with this crisis and the next one.
Thank you for tuning in to ODI Bites. Find out more on odi.org/events.